Today, we're going to discuss mini facelifts and neck lifts. What's the difference, who it applies to, how it's done, what the risks are, and how you can benefit from this procedure. I'm Dr. Joel Kopelman. I'm a facial plastic surgeon, and I cover topics of cosmetic plastic surgery, particularly around the face and the eyes. If you're new to my channel, click the red subscribe button so you can stay up to date with the new releases that I have on a weekly basis. So let's get into the meat of this. What is the difference between a mini facelift and a neck lift? First of all, a mini facelift is really not really that mini. It actually is an incision that stretches from the top of your ear over here, or your hair tuft over here, all the way down around the ear here, and up behind the ear and along the hairline. So that incision is not exactly mini. It's actually longer than we like to talk about, because people like to hear the word mini thinking it's very small, very tiny, and something that's imperceptible. Yes, it is true that long incision does heal very well if it's done properly, and the incision is somewhat imperceptible over time, but it is not a tiny incision. Now, a neck lift incision is primarily around, starting in front of the ear lobe itself and going back behind the ear around into the hairline. And I'll explain to you when mini facelifts are appropriate and when neck lifts are appropriate. Typically, a mini facelift or a neck lift is appropriate for someone who's around anywhere from 35 to 55. And of course, there's variations in between. Of course, there may be people who need more extensive work at the age of 55 than the average person. But it generally is reserved for people who are younger. And why that is because the amount of age-related changes that have occurred really haven't advanced that far. Okay, so that the laxity in the neck, or the lack of definition along the jawline, the jowls, and the laxity of the skin may not be as advanced as it is, say, when you're 65, which is obvious, but it changes our approach and our selection of what kind of procedure is appropriate at a different age, in different age groups. So a mini facelift in particular is, as I said, is an incision that goes from the hair tuft all the way down and around, and that's in someone who we want to raise the jowl upward, and the jowl is over here. We want to vertically raise the face, tighten the skin, create greater definition along the jawline, so there isn't a blending of the face with the neck. So there should be a demarcation between your jawline and your neck. And then, of course, tighten the laxity in the central portion of your face. So that happens by lifting and pulling the deep tissues back as well as the skin. So now what we're doing is actually tightening the muscle layer deep to the skin and a connective tissue layer deep to the skin, tightening that up vertically, and then laying the skin down horizontally in a very natural way so it doesn't look pulled and you don't have these stretch lines that go up like this. So it's actually a two-plane tightening that's occurring. A neck lift, however, is someone who just has laxity of the central portion of their neck, and they just want to have a better tightening effect down here by pulling up here, and you can do a very limited incision around the base of your earlobe and going up behind your ear, so you don't even have to extend the incision higher. But that isn't someone who doesn't have a lot of skin laxity, but has kind of a laxity of the neck muscle and fascia that's below the skin. And of course, the skin can be trimmed behind the ear, and all the incisions that are made are well concealed around the natural contours of the ear, the hairline, and the back of the hairline over here. so that you can even wear your hair back if you choose to do so. Of course, not immediately. It takes several weeks to months before those incisions mature and fade and disappear. So these incisions will become imperceptible over several months, and in the interim, of course, you can cover them if you choose to do so with makeup, and that's usually within 7 to 10 days. You can use makeup on those areas. In men, however, if they have a heavy beard, sometimes we modify the incision in front of the little structure here called the tragus, so that we don't pull the beard over the tragus and have hair growing out of the tragus area right here. But that's rarely. Most of the time, even in men, I make the incision behind the tragus so that it looks, in the end, very natural. The wounds heal very well, and I can't emphasize that the incisions are critical. Some people are not as meticulous about their incisions, and they end up showing and exhibiting the stigmata of a facelift, which we don't want. We want people to heal well and not have the evidence that they had a facelift. I want to emphasize here that non-surgical, quote, facelift procedures are not facelifts, and they never will be. Okay, so that's like ultherapy, microneedling, lasers. Those therapies can improve the skin quality. They can tighten the skin a little bit, but they can't lift a lax jowl or neck and recontour the face the way a facelift can. I see these procedures as adjuncts to a facelift. They can enhance a facelift by improving the skin quality and texture of the skin, and sometimes tightening the skin of the face, but it cannot lift the deeper tissues like muscle and fascia and connective tissue upward enough to make a significant difference. I understand why people want to go towards non-surgical treatments. They don't want to go through surgery and the recovery and so forth, but it won't give them the same final result that a facelift will. I've done many facelifts and necklifts, and the results can be extremely dramatic and life-changing to the patient. This is in comparison to some of these non-invasive procedures, which of course can last about 6 months to a year before they have to be repeated again. Again, I think they're good as add-ons to a facelift because they can enhance the final result. But a facelift is in a category unto itself, and I think that a mini facelift in the appropriate age group is an ideal procedure that can give you dramatic results and be a very safe procedure. So let's talk about how long a mini facelift or a neck lift typically lasts. It lasts about 10 to 15 years. But of course it may vary in someone who drinks heavily, loves to sunbathe, likes to smoke. All those things are going to accelerate the aging process and undermine the longevity of a facelift. As I mentioned, I think that the mini facelift or the neck lift is an excellent option in those patients 35 to 55 in most cases. There are limits on what this can achieve, however, in the mid-face area. The mid-face area can be deflated due to fat atrophy or muscle atrophy or changes in the bone. In those cases, you have to be able to enhance that volume, and usually that's done with either a fat graft or a filler to compensate for the volume loss. If you're interested in this procedure, I would seek a surgeon who has a lot of experience doing facelifts, whether they're mini facelifts or full facelifts or deep plane facelifts or neck lifts. You got to find the right person who has experience doing these facelifts. At the time of your preoperative visit, I recommend that you bring your old photographs to your facial plastic surgeon so that they can look at what you looked like in the past relative to what you look like now. That helps define what your expectations are. I tell patients that I don't want to change their appearance. I want them to look like a younger version of themselves. I don't want them to look dramatically different. because I think that's too dramatic a change from what you currently are. I want you to look refreshed and natural and real, and I don't want you to look plastic. So I think that defining the expectations is a critical step in the preoperative visit, and that's something we go into in great detail. So the second part of this process is don't schedule a facelift for 6 to 8 weeks prior to a major event. In addition, you have to stop Advil, Motrin, vitamin E, fish oil, anything that's a blood thinner prior to the procedure. You have to have a medical evaluation. We have to go through whether you have any allergies, any other limitations on the surgery itself, whether you ever previously had any anesthesia issues. All these things have to be taken into account. Nothing can be skipped over. Everything has to be done in a very regimented way in order to not miss any information. So the day of surgery arrives. Of course, you've stopped food and water as of midnight the night before. You have someone drive you from your home to the surgery center. At that time, they'll check you in, and the surgery typically lasts about 3 to 5 hours. Someone has to bring you home after surgery, and I always insist that someone stay with you overnight. So you have to have either a companion or family member stay with you overnight just to be sure everything's okay. And let's talk about what the recovery is like. First of all, there's minimal to no discomfort or pain associated with the surgery. I only use non-narcotic painkillers because there is virtually no pain associated with it. There may be a little soreness, a little stiffness, but in general, there's very little discomfort. There's probably going to be a drain that is placed underneath the skin in your neck, and that drains away any fluid that drains down by gravity, and that's a good thing because we don't want fluid to collect on your neck, and it may stay in for 1 to 3 days depending on how much fluid we see after surgery on day 1. Then you will have sutures typically removed within 5 to 7 days around your ear. There may be some metal clips or staples in this region and maybe along the hairline back here, and they stay in for approximately a week. What I recommend is that the next day you should be able to go out and walk around. There's no reason you can't. Even if you have a drain in, you can walk in your neighborhood. If you wear a scarf, you can take a shower the next day. But I do recommend that you stay home for at least a week following this procedure, and maybe about 2 weeks before you have social interactions again, because you may have some bruising, and the incisions are going to be noticeable at that point. It depends on the individual how self-conscious they are about these things. And then it's going to take several weeks to months before the incisions mature and fade, and so that you can go out without any feeling of hesitancy about interacting with anyone. So you do have to put aside enough time to go through the procedure as well as the recovery, and you have to anticipate at least a week off from work and several weeks before the swelling and bruising subside. So I hope this video was informative and helpful to analyze what exactly a mini facelift is, a neck lift is, and how it compares to other types of facelifts, which we're going to discuss in future videos. If you have any further questions, please leave them below and subscribe to my channel. I look forward to seeing you again in my future videos.